for clients who sustained injuries as a result of medical negligence or clinical negligence. This can arise from a number of different situations. Sometimes it's a misdiagnosis or a delayed diagnosis, or it can be from surgical error. What's common to our clients is that they've been let down by a healthcare professional, and it usually has devastating impact on them and their families.
The process of bringing a claim can then be a daunting one. Claims take a long time and they can be difficult. We try and support our clients throughout the claim and make sure that the impact of the claim is then minimised. At Stewart's, we only have a small number of cases per lawyer at any one time. This means that we can go out, we can meet our clients, we meet their families, we get to understand what their needs are and what their goals are. Every claim, every client is completely different.
One of the things we are often asked about in our first meetings with clients is whether bringing a claim is going to affect their ongoing treatment. And the short answer is no. You shouldn't have to change doctors or hospitals unless you want to. Alongside the litigation process, Stewart's are able to offer additional support from an in-house rehab coordinator. We also have a pro bono department who can provide legal advice on a range of issues which clients may be facing alongside their legal claim. We always try to get early admissions of liability from the defendant because this means that we can get interim damages payments. So that's an advance payment on your compensation. This means that clients can use that money to pay for things like therapies, new equipment, or accommodation adaptations that they really need to happen straight away.
So although the primary purpose of litigation is to get compensation, what we can also look at is whether there's anything beyond that as by way of resolution. When we get admissions of liability, we can look at an apology, or we can look at whether there are any ways of preventing the same thing from happening again in the future. A recent example of this is a case of mine where we have an admission of liability. We have received an apology, and also the client's family have been invited into the defendant trust to hear firsthand the changes that have been made to prevent the same events happening again, and also to get across to the clinicians involved the impact of the injury on the client and on the family as well. This way the client feels listened to, and they've also got compensation that means the client has their lifelong needs met.
Our goal is to support our clients through the litigation process, which can be long and it can be stressful, as we've explained. But ultimately, we want to get the right amount of compensation for them so that they can move forward with their lives and be able to live as full a life as possible after their injury.